Hi, this is Diana again, and in this video we will be covering the third part of our module on how to navigate the healthcare system. Creating a personal health plan is easy with our app. Here's how you can do it step by step. Step 1. Take the sexual health quiz. First, open the app and take the sexual health quiz. This quiz will help you think about what you want when it comes to your sexual and reproductive health. For example, are you thinking about avoiding pregnancy or are you planning to become sexually active? The quiz will help you figure out what's most important to you. Step 2. Start a conversation with a virtual promotora. After you finish the quiz, you can chat with a virtual promotora. You can talk to us about your thoughts and feelings and we'll help you make sense of everything. Step 3. Meet with a healthcare provider. Next, it's time to see a doctor or a nurse. Use the app to schedule an appointment with a healthcare provider. When you go to your appointment, make sure to tell the doctor about your health goals and any concerns you have. If you're nervous or need help getting ready, you can always reach out to a virtual promotora for support. Step 4. Set personal goals. During your appointment, your healthcare provider will help you set some personal goals based on what you learned from the quiz and your conversations with the virtual promotoras. These goals will be about taking care of your sexual and reproductive health, and they should be things you feel good about achieving. Step 5. Use the sexual health quiz as a tool. Keep your sexual health quiz handy. You can use it as a guide when talking to your doctor. It helps make sure you cover everything that's important to you during your visit. By following these steps on the app, you'll have your very own personal health plan that helps you take charge of your health and sexual and reproductive needs. Having a health plan is important because it helps you take care of your body and make sure you're healthy and happy. Let's break it down. It helps improve your sexual health. A health plan is like a map that helps you reach your goals. For example, if you want to avoid getting pregnant or manage period pain, your health plan will give you the steps to make that happen. This way, you can make sure you feel better and stay healthy. Take charge of your health. With a health plan, you're in control. You get to make decisions about your body based on what you want and need. This means you can choose what's best for you instead of just going along with what others say. Talk to your doctor better. When you have a health plan, it's easier to talk to your doctor. You can share your goals and concerns, and your doctor can help you more because they know exactly what you want, and only because you know exactly what you want. This makes your visits more helpful and personal. Get the right support. This is especially important if you don't always get the support you need. The plan gives you advice and help that fits your culture and needs so you can feel understood and supported. Make sure nothing important is missed. Sometimes doctors are busy and might not have time to talk about everything, but with a health plan, you make sure that important things like your sexual and reproductive health are not forgotten. This way, you get the care you need, even if time is short. Although most teens don't need to have a pap test until they are 21 years old, there are at least 21 reasons to see a gynecologist before then. And as we've learned, preventive care is very important. The following is a list of 21 reasons to see a gynecologist before 21. 1. Learn about healthy lifestyles and how to feel good about yourself. 2. Discuss good habits for healthy bones. 3. Learn if you have a urinary tract infection or UTI and the treatment options. 4. Get treatment for vaginal itching, discharge, or other symptoms. 5. Learn if your periods are normal. 6. Get relief if your periods are painful. 7. Find out why your periods are too heavy. 8. Discuss the timing of your periods and why bleeding may occur in between. 9. Learn ways to deal with premenstrual syndrome, or PMS. 10. Learn how to have healthy romantic relationships. 11. Learn what it means to be in a consensual relationship. 12. Ask questions about what it means to be lesbian, gay, bisexual, transgender, or queer. 13. Learn about safe sex. 14. Talk about how your reproductive system works. 15. Discuss birth control options. 16. Discuss the ideal time to start a family. 17. Get tested for pregnancy. 18. Weigh your options if you do get pregnant. 19. Learn how to lower your risk of sexually transmitted infections, or STIs, including the human immunodeficiency virus, or HIV. 20. Get tested for STIs and HIV if you are sexually active. And 21. Get the human papillomavirus vaccine, or the HPV vaccine. Working with your healthcare provider is important to make sure you get the best care and understand what you need to stay healthy. Here's how you can do it. Good communication helps you get the care you need. Before you go to your appointment, write down any questions or things you're worried about. This way you won't forget to ask anything important. Bring someone you trust. It can be helpful to bring a close friend or family member with you to your appointment, and totally valid too. They can support you, help you remember what the doctor says, and even take notes for you. Which leads us to our other point, take notes. When you're with your doctor, write down what they say or ask your friend or family member to do it for you. This helps you remember the doctor's advice and instructions later on. You can take a small notebook or even use your cell phone. Keep track of your health information. Learn how to access your medical records. These records include your test results, diagnoses, treatment plans, and medications. Keeping track of this information helps you prepare for your next appointment and stay on top of your health. Get contact information. Ask your doctor or healthcare provider how you can reach them if you have more questions later. Find out their preferred way to communicate, like by phone, email, or online on a patient portal, so you can stay in touch easily. Remember other helpers. Nurses and pharmacists are also great people to ask for advice. They can answer questions about your health or medicines and give you helpful tips. By following these steps, you can work well with your healthcare provider and make sure you get the care and support that you need. Getting ready for your medical appointment is easy and helps you get the best care. Here's what you can do. Write down your symptoms or concerns. Bring your medical history. This includes any medicines you're taking right now and any important health information. This helps the doctor understand your health better. Make a list of questions. Write down anything you can think of that is important to ask your provider. That way you don't forget it. By doing these 3 things, you'll be ready for your appointment and can get the answers and help that you need. Did you learn anything new about navigating the healthcare system? Do you have any questions about what we just covered? Make sure to write anything new that you learned in the notes section of this app so that you can later refer to it when we start making your health plan. And feel free to reach out to a virtual promotora if you have any questions.